Hello everyone, good evening. 8 June of every year, we are celebrating Brain Tumors Day. I am Dr. Jayesh Sargara, the Senior Consultant Neuro and Spine Surgeon in the Fortis Hospital, Mulur. Idea is to celebrate the Brain Tumors Day is to enhance the awareness of the brain tumors, how to detect early, how to diagnose it, what are the options. Today we'll discuss about everything, what minimum we should know about the brain tumors. There are so many myths all around. We are hearing day to day, and now I in the on the basis of these things, I want to clarify majority of myth of the brain tumors. So here it is. First of all, how common in India? So, International Cancer Registry says that in India there are 28,000 approximately brain tumors we detect yearly, and prevalence is 5 to 6 per 1 lakh. तो कितने में होता है? 5 to 6% per lakh. That is the International Cancer Registry, which is detecting the Indian prevalence of the tumor. In children, it is the second most common tumors of the whole body. The CNS tumor is the second most common. Why it is happen? So there are many myths that laptop, mobile, radiation, head injury, alcohol उससे brain tumors होता है. It's a myth. No. It's basically a genetic mutations. 23 pairs of gene में से one of them may be mutated spontaneously or may be hereditary. That is a common cause. Sometimes because of radiation exposure, overexposure of the radiation, particularly in pediatric age, बच्चों में, then the adult age may convert into, it is although not common cause, but yet it is radiation. So that's why it's always recommended that the radiation should be less and less, particularly in child. Other things is hereditary. क्या फैमिली दर फैमिली सारे ब्रेन ट्यूमर्स जाते हैं? क्या पेरेंट्स में हुए तो बच्चों को ब्रेन ट्यूमर्स होंगे? आंसर इज नॉट एग्जैक्टली. 20 to 30% are only brain tumors which run in the family. So that is very important, and you should remember that every brain tumor not goes into family. What are the types of the brain tumors? So there are two type of brain tumors mainly. We call it primary or secondary. So primary means brain tumors occurs in the brain primary, detected in the brain. Secondary means there are other tumors in the body somewhere else, like lungs, breast, spine, and then it spreads into the brain. We call it metastatic brain tumor. So primary and metastatic brain tumors. Metastatic brain tumors always having a poor prognosis. Other classification is benign or malignant. So हम हमेशा कहते हैं कि क्या सारे ट्यूमर्स, इट्स ऑल्सो वन ऑफ द अदर मिथ्स, क्या सारे ब्रेन ट्यूमर्स कैंसर है? No. Answer is no. Majority of tumors are benign and curable. So if we remove completely, the chances of recurrence of benign tumor is almost none, very rare. Compared to cancer, which is almost uncurable. So what are the most common benign tumors in our brain? The most common tumors I may talk about is the meningioma. We call it ऊपर की जो skull की नीचे की ड्यूरा में से होता है, it's called meningioma. If we can excise completely, it is curable with very good life. Most common brain tumors which is malignant or cancer is the glioma. So न्यूरॉन के साथ ब्रेन में ग्लायल सेल्स भी होते हैं जो सपोर्ट करते हैं न्यूरॉन्स को. सो ग्लायल ट्यूमर्स के ट्यूमर्स को हम ग्लायोमा बोलते हैं और ग्लायोब्लास्टोमा बोलते हैं, जो मोस्ट कॉमन कैंसर है. कॉमनली मिडिल एज में होता है, इन बिटवीन 40 to 60 years of age. So these are the two major types. What are the age in which brain tumors occurs? So as I told you, in children it is the second most common tumors. So there are two types mainly in children also. One is benign, उसमें भी benign and cancerous. सो बच्चों में जो होता है लेस देन 10 to 15 ईयर्स में डिटेक्ट होता है अर्ली. सो पर्टिकुलरली लेस देन 5 ईयर्स ऑफ एज होते हैं, उसमें अगर ब्रेन ट्यूमर्स है, सो दैट इज मोर मैलिग्नेंट और कैंसर, एंड दैट इज मेडुलोब्लास्टोमा, दैट नोन एज मेडुलोब्लास्टोमा. 10 साल के ऊपर 20 साल के नीचे जो बच्चों में होता है, दैट इज पाइलोसिटिक एस्ट्रोसाइटोमा, वन टाइप ऑफ वेरी बिनाइन ग्लायोमा, जो काफ़ी हद तक अच्छा प्रोग्नोसिस है. इट इज ऑल्सो वी कैन से क्योरेबल. कैंसर मेजोरिटी ऑफ पेशेंट में आफ्टर 50 to 60 ईयर्स में होगा, एंड दैट एज ऑफ ग्लायोमा इज 40 to 60 ईयर्स ऑफ एज. सम आर लो ग्रेड ग्लायोमा, सम आर हाई ग्रेड ग्लायोमा. सो उसमें भी 4 स्टेजेस होते हैं. सो फर्स्ट एंड सेकंड स्टेज ऑफ द ब्रेन ट्यूमर और कैंसर इज अ लो ग्रेड, 3 and 4th इज अ हाई ग्रेड. सो डिपेंड, उसकी वजह से उसके हिसाब से हम आपको प्रोग्नोसिस समझाते हैं ब्रेन ट्यूमर्स का, कि हाउ मच मंथ्स लाइफ इज रिमेन आफ्टर सर्जरी. Now, this is all about age. So, how to detect early? What are the symptoms? Sometimes, see, most common symptoms of brain tumors is headache. Now, बाकी headache और brain tumors के headache में क्या फ़र्क है? ब्रेन ट्यूमर्स का हेडेक अर्ली मॉर्निंग होगा. इट्स क्लासिकल अर्ली मॉर्निंग हेडेक, यूजुअली अकर्स डेली एंड प्रोग्रेसिव. बाकी जो हेडेक होते हैं, माइग्रेन के हेडेक या स्ट्रेस का हेडेक, इट विल नॉट बी अकर, यूजुअली फ्रीक्वेंटली आते हैं, मंथली होते हैं, 2 मंथली होते हैं. ब्रेन ट्यूमर्स का हेडेक अर्ली मॉर्निंग होगा, राइजिंग होगा, यूजुअली फॉलोड बाय वॉमिटिंग. पीक ऑफ द हेडेक पे हमेशा ब्लरिंग ऑफ विजन होगा, थोड़ा बहुत विजन भी अफेक्ट होता है. So that's how we differentiate. Other things, if you find in some patients a personality changes, like aggressiveness होना या हमेशा सुस्त रहना, it may present with the seizures also. Focal deficits, एक हाथ का वीकनेस, पैर का वीकनेस या नम्बनेस, तो ज़्यादातर ये पॉसिबिलिटीज है. फेस में सेंसेशन लॉस होना, एक तरफ का हियरिंग लॉस होना, फेशियल वीकनेस होना, समटाइम्स इट में प्रेजेंट विथ लाइक दैट ऑल्सो. अदर प्रेजेंटेशन, सो समटाइम्स वी ऑल्सो फाइंड इंसिडेंटली कि किसी और वजह से हेडेक था, सीटी स्कैन कराया ब्रेन का एंड ट्यूमर्स निकल आया. In the brain tumor day, I also want to emphasize on the messages to all the general practitioners that if there is a headache, if headache is more than 6 months prolonged, please do prescribe at least CT scan to the patient or MRI. For screening of the brain tumor, only non-contrast CT scan or non-contrast MRI would be enough. No need to put a contrast on first prescription, because many of patients have kidney issues, many of patients have allergy to the dye, so that can be preserved. So how we detect? So in the screening, suppose we find out some tumor, in our usual protocol is we write MRI with contrast. So we came to know what are the spread of the tumor, कितना फैला हुआ है, कौन से critical structures को involve कर रहा है. After that, now in the Fortis Hospital Mulund, we have one very advanced instrument we called navigations, and that is definitely help us to detect during surgery that where we are working and how much is the progression, and also helps to do a minimal invasive brain surgery. So that usually we do. Now coming to the treatment, now we know there are brain tumors, we detect it. They depend on benign or tumors. First message to treatment, there is a myth that दवाइयों से भी ठीक हो सकता है. Brain tumors, the principal treatment is surgery. सर्जरी से मैक्सिमम सेफ ट्यूमर निकालने के बाद डिपेंड ऑन रेसिडुअल ऑफ द ट्यूमर कितना परसेंट है. बेस्ड ऑन दैट वी गिव एडजुवेंट ट्रीटमेंट, कीमोथेरापी, रेडियोथेरापी, and now new things is came, that is gamma knife. We can go for that, but surgery is the primary. Early detection of brain tumor will give you a curable good prognosis. अर्ली सर्जरी इज ऑलवेज बेटर. जितना ट्यूमर छोटा होगा निकालने में कॉम्प्लिकेशंस कम होंगे, जितना साइज बढ़ेगा उतना कॉम्प्लिकेशन रेट ज़्यादा है, Chances of benign tumor to malignant tumor is also 30%, and particularly after 45 years of age, benign tumor malignant में भी convert हो सकता है. That's why always early surgery is better. Now surgery के भी दो types होते हैं. In this advanced era, we have a facility of minimal invasive brain surgery for brain tumors. उसमें क्या है, we do, पहले क्या होता था ब्रेन ट्यूमर्स के लिए, we have to have a big incision, big tumor flap, skull का flap उठाते हैं, then we reach to the brain tumor. The chances of neurological deficit and uh, recovery period is also long. Now it's era of endoscopy, so we require just a single hole, burr hole, small flap, small incision, without hair remover. We can use small keyhole type craniotomy with the help of microscope or endoscope. हम पूरा का पूरा tumor निकाल सकते हैं without neurological deficit, because we have a neuro navigation machine जिससे हम exactly पता चलेगा कि exactly दिमाग में कौन सी जगह पे exactly tumor extend कर रहा है. So exactly precise incision and precise surgery is possible in our Fortis Hospital Mulund. Second, that's what we call it keyhole brain surgery. Recovery period is very less and deficit chances is very less. After surgery, if tumor is remain 10%, 5%, then we can go for gamma knife, that is a radiation by gamma rays, very precise radiation, no need of, there will be no neurological deficits, chemotherapy and radiation therapy. So if you ask me the prognosis, if you detect early, the tumor is having very good prognosis. If benign tumor, then it is curable. Even in cancer, some type of cancer, it's a good prognosis. Except in glioblastoma stage 4 tumors, अगर वो late detect होता है, the life prognosis is very poor. So what are the myths? Again, I would like to emphasize here, there is no link between mobile head injury, alcohol to the brain tumors. ब्रेन ट्यूमर्स का इलाज दवाइयों से नहीं होता, ऑपरेशन करना ज़रूरी है. अर्ली सर्जरी इज ऑलवेज बेटर. Not at all, it's not necessary that all the tumors are cancer. Many of tumors are benign and it is curable. So brain cancers are a huge challenge, but we are here to take care of you. And we are also running one brain tumors supports group in which every patient can give a feedback to each others. कोई भी related questions, so we are here in the Fortis Hospital Mulund to help you out. Thank you so much.